that is 50.9 years. So generally, women could reach menopause anytime between 45 and 55. So that's the range, but on average, it's about 51 years. Some women can reach it as early as 35 years.
Okay.
And we only call it premature menopause if women reach menopause less than 35 years of age. And obviously, we also need to investigate the woman further if she's still having menstruations after 56 years of age. So I think menopause is, the scientific definition is just the last menstrual period, but the impact on a woman's life is far more impactful than that. In that, she has changes going through in physical body, her mental health issues, and also emotionally, there's changes that occur.
Now, you did mention that, the general age for menopause is 50.9 years. And anything, if it's below that, it can probably be pre-menopause, we can call it.
Perimenopause.
Perimenopause, yeah. Now, what influences menopause? I mean, whether it's going to be at 50 or whether it's going to be at 40 or 52 or whatever it is.
So the most important indicator is genetics, believe it or not. So the age a girl reaches her first menstruation or menarche is directly related to the age that her mother reached menarche. So also the age of menopause mirrors your mother's age of menopause. So if you find that your mom had a menopause around 43, then it's more likely that you would have menopause earlier. The other factor is generally the heavier women who have an increased body fat. They have testosterone being converted to estrogen in their peripheral fat, and therefore they may reach menopause later.
Okay. Now, you did mention that, if your mother had a menopause at 43, you're probably going to get it at 43 as well. Now, is this for all the children or all her daughters, or
all
just
the daughters
across the board?
Yeah.
Okay.
So generally, if you've got an older sister, you would also, your age of menopause would be similar to hers. It's not an absolute, but in general.
Yes, absolutely. This is an interactive show, and I'm sure you have many questions on health during menopause and matters related to the topic. You can forward your questions to us via WhatsApp on 060 904 1056. I repeat, 060 904 1056. The topic for discussion is health during menopause, and our special guest is Dr. NASEERA MAHOMED, a specialist obstetrician and gynecologist practicing at the Westville Hospital. Now, Dr. MAHOMED, what are the common symptoms that women experience, and are there lifestyle changes that make a difference?
So the commonest symptom that everyone talks about are hot flashes, or as the Americans say, hot flashes.
Okay.
And actually, not all women get hot flashes. Only 75% of women get hot flashes. And women experience them in different degrees. Some people have severe, debilitating hot flashes that affect their lifestyle or their working life. And then some people have generally very mild symptoms. The thing that makes a difference is their attitude to life and their level of physical activity. You will notice the women who are more active and have a quite positive outlook in life, they tend to handle the menopause far better. Exercise is important because you release endorphins, and that helps all kinds of symptoms within the body. Also, the menopause impacts the mental health of women. And you see lots of women in this age category who start to have depression and anxiety where they never had it before. So I always say, before a health provider prescribes antidepressants or anxiolytics, I think it's important to address the hormonal imbalance in the woman before we think we need to prescribe psychiatric medication.
Now, in order to, address the hormonal imbalance, how does one do that? I mean, who does one go to?
So people do different things. So, because of the bad publicity surrounding hormone replacement therapy, a lot of people are averse to taking hormone replacement therapy. And you would find that they've gone to the health shop and they've gone to the pharmacy and the naturopath and the homeopath. And all those medications have a role. For women who are having severe hot flashes, I think they would then need the hormone replacement therapy. But it's a very individualized decision. And, women need to understand that their response to the therapy will also depend on what their expectations are. So if they are expecting to experience side effects, then they will experience. So that's why women must be prepared to say that they're ready to go on therapy and then embrace it and understand initially everything has an adjustment phase. If a woman's really averse to taking medication, you can ride it. It just depends what her level of functioning is. So if she's a woman who is in a high-performing job, in a corporate environment or whatever, and you will notice there are many, many aspects of her life that would be impacted by the menopause. So if she is finding that she's not managing to cope in her day-to-day function, then it's important for her to take the hormone replacement therapy. But I feel like it must be a conversation and you must give the patient a choice. And for me, I don't try to convince patients to take any medication. And if they're open to trying it, then you say to them, go try it. And if you see value in it and you see that your life has improved, then you make an informed decision about continuing therapy. Actually, on a flight to Joburg, I just stopped at Exclusive Books and there was this book that caught my attention. It's called Blind Spots. It's written by Dr. Marty McCarvey. He's a John Hopkins graduate. And he talks about when medicine gets it wrong. And the second chapter in that book is on hormone replacement therapy. So for anybody who's skeptical about hormone replacement therapy, it's a very good read. It's a scientific basis. And also he says, because there were lots of studies that were ill-designed that gave false information. And although there've been more evidence recently to say that there's more benefit than risk, patients can't get out historically the bad information that they were exposed to. So I think we must be objective. We always treat symptoms and not blood results. So many women would come to the doctor and say, okay, I'm now 40, can you please do my hormone test? But generally we manage menopause on clinical symptoms. And we want to address a good quality of life because women are spending a longer period now in the menopause. Many years ago, women like the average lifespan was 65. So generally what they did from 50 to 65 didn't matter too much. But now because women, the average lifespan is 85 and women are quite functional for much longer, it does matter what you do at the menopause in the long run. So in terms of your bone health, your heart health, and most important, your quality of life.
Absolutely.
Because we now talk about health span and not lifespan. It's not about clocking hours on earth. It's how many years are you functional and enjoying good quality of life and capable of independent living.
2 questions come through. The first one says, question for Dr. Mohammed. Is it common for women in menopause to experience diet changes and appetite suppression or increase as well as weight gain?
So there's an inverse relationship between estrogen and abdominal obesity. And so the middle age spread is absolutely real. So as the estrogen level drops in your bloodstream, you get increased deposition of fat on the abdomen or in the waistline. And you must know for your cardiovascular risk, the risk comes from your increase in your abdominal girth. So in terms of weight gain, it's absolutely real. And you'll speak to women who reach the menopause. They'll say, but I'm eating far less, but I keep on getting bloated on my tummy. So I think that's really real. It is there. And that's because your metabolism slows and your estrogen drops so that we get increased in fatty deposition on the abdomen. You also get a redistribution of fat from the hip to the abdomen. So I think that is the reason that exercise is so important, because even you may think that you've really cut down what you've eaten, you will still, the little bit that you eat gets deposited as fat.
Thank you for that, Doctor. The other question comes, Assalamu alaikum wa rahmatullahi wa barakatuh. Wa alaikum salam to you. I am 68. Is it normal to get hot flushes at this age only at nights? Shukran.
So it's very interesting, because if you read the textbooks, it says that hot flushes last for 6 months to 18 months. But in practice, we see patients who've been flushing for years. And of course, it's important to exclude other causes. So you make sure their thyroid function is normal. And you can have people who continue to have hot flushes. What's important is we never initiate hormone replacement therapy at an age of 68 if you're having hot flushes. Then there are other things we use, like Effexor, and that for treating just the flushes, and it's a non-hormonal treatment that we use, and we harvest that side effect of it in reducing the hot flushes.
Another question comes to the doctor is, Salams, I want to know, my period stopped at 40 years. Now I'm 70. My body gets hot summer or winter. I can't wear a blanket. I sleep with cotton sheet. I'm taking pressure tablets. That's the question. Is it normal?
Yeah, so as I was saying, that okay, Durban's hot, humid, and it does make a difference, but it's very real. And like the hormonal flushing is always at night. So characteristically, some women flush throughout the day, but the most disturbing hot flush is actually at night.
Okay. And the fact that she's 70 years old makes no difference?
No, that's what I'm saying. They can still be.
They can still be. Okay.
Yes.
060-904-1056. We are discussing health during menopause, and our special guest is Dr. NASEERA Mohammed, a specialist obstetrician and gynecologist. Another question comes through. Is a burning mouth or burning mouth syndrome normal? I get them every now and then. I'm not sure if it's related to our topic, but come from a sister maybe. Burning mouth and burning mouth syndrome.
I'm not too clear about that, but I do know that the menopausal hot flush is generally from the chest upwards, so you feel it in the face. But specifically a burning mouth, I'm not sure. Is the patient diabetic or anything?
No, she doesn't say that, whether she's
Okay.
diabetic. Yeah. Right, 060-904-1056. We look forward to receiving your questions. Now, Dr. Mohammed Prayat, okay, I think another question has come through. Salams, my wife is only 40 and was diagnosed with premenopause. Her libido is non-existent and it's taking its toll on our relationship. Her doctor says she must just take her birth control pills, and it does nothing, but just gives her a normal menstrual cycle. Do you have a solution for us, doctor?
That's a very common problem, and that is the intimacy in the menopause. Is women, as they reach menopause and even in the perimenopause, will find, because of the hormonal changes, they have a reduction in libido. And as a result of that, the women tend to become less active. Besides just the hormonal effects on libido, physically, there's a reduction in the estrogen in the vaginal walls. So the vagina becomes what we describe as atrophic, so it's more fragile. When there's friction with intercourse, then you get little cuts into the vaginal mucosa, and there's extreme burning afterwards. Some women even can have an increase in urinary tract infections because of this atrophic vaginitis. So then women are really in a fix, because there's two reasons now why intercourse becomes almost impossible. But it's important to remember that we must address this issue, because it doesn't get better unless you do something. So as time goes on, the vaginal atrophy just gets worse. And there is treatment for that. So the libido you can address with estrogen, and now more recently there are also testosterone therapy patches that are available. And before, they were used to use compounded testosterone as well. So I think it's something to address because marriages suffer, and you will find that now men still have a libido. I think men just never stop having a libido. So for women, it's a battle to keep up. And I believe that libido is like a bicep muscle. So if you don't use it, you lose it. So it's important. If women are averse to using vaginal estrogen therapy, then at least they should use a vaginal moisturizer.
Two questions come from the one caller. It says, at what age, Assalamu alaikum wa rahmatullahi wa barakatuh, wa alaikum salam to you. At what age does women need to stop taking HRT? And the second question, just related to what you spoke of earlier, advise the benefits of taking vaginal estrogen.
Okay.
So we can deal with them separately.
Okay. So initially, we were prescribing HRT for life. And then we went through that phase where there's some bad publicity. So people said the lowest dose for 5 years. Now we know that you can safely continue using HRT, provided there's been no change in the woman's health. So if she's had no contraindications to HRT, like clotting or pulmonary embolism or autoimmune disease and that. So generally, you don't need to stop your HRT as long as you've been monitored and you are having your regular mammograms. The mammograms are not to say that HRT causes breast cancer. It's just to know that while you're on the therapy, if you do develop breast cancer as you were supposed to, then sometimes the estrogen may cause it to grow because you were undiagnosed. So there's absolutely no contraindication to continuing the HRT, provided it's at a low dose. Women who are feeling exceptionally worried then can change over to Tibolone or Livifem, which is a SERM, a selective estrogen receptor modulator. So there's no reason to stop. Before we used to stop it, say you take it for 5 years and then review whether you want to continue. Vaginal estrogen, because the trend is now to do the lowest dose, effective dose of estrogen, some women will still need a vaginal boost. So it's always preferable to use a lower dose systemic estrogen and then do a vaginal boost with either a vaginal pessary or vaginal cream.
Two questions come through again on this vaginal estrogen. Are there any side effects? That's the first question.
Okay.
And what if I'm taking medication for other complications? They refer to diabetes, blood pressure. Yeah.
Okay. So generally, if you start your hormone replacement therapy within 2 years of reaching your menopause, the benefits are greater even if you're diabetic and hypertensive, because if you're diabetic and hypertensive, you're more prone to getting cardiovascular disease. And we do know that if you start estrogen therapy in that 2-year window, you actually are going to be protecting your blood vessels against damage. You will find that normally men have a higher incidence of heart attacks as compared to women. And the main reason for that is because women are protected by estrogen.
Okay.
So postmenopausal women who are not on estrogen are more, they have an equal frequency of cardiovascular events as men. So you can still continue your HRT if you're diabetic or hypertensive. Obviously, you may reduce, you may want to monitor your blood pressure and make sure you're on the correct prescription, and that doesn't involve increasing your blood pressure.
There are a few more questions coming, but I see it's like, okay, there's 2 minutes to average. I'm sure you can deal with the next question. Assalamu alaikum. I'm having sore breasts now in menopause. Even though I have low estrogen, libido is low, and trying to use coconut oil mixed with vitamin E capsules to help with Vegifem has helped a bit, alhamdulillah.
Yes, so she's talking about the coconut oil, probably vaginally.
She doesn't say how she's using it.
Okay.
But she said mixed with vitamin E capsule. So
yeah. So generally, the tender breast can be part of the perimenopause. So it's like when you have in PMS, you get tender breasts the 2 weeks before your period. In the perimenopause, the breast can be tender randomly.
Okay.
And lots of women will complain of that. And evening primrose oil does tend to help with that. In terms I think there was a question there about the side effects of vaginal estrogen.
Yeah, that was a previous question.
Yeah. So in women who are sensitive, sometimes initially when you start, you may feel some sensitivity, but vaginal estrogen works locally. So there's a very minimal amount that's systemically absorbed. And therefore, the vaginal estrogen we regard as extremely safe to continue for as long as a woman wants because it's not systemically absorbed. It acts as local therapy, although there's minuscule amounts that go into the bloodstream.
Thank you, Dr. Parak. We're going to be visiting the marketplace. We'll continue after this. Our special guest is Dr. NASEERA Mohammed, and our topic for discussion is health during menopause. Any questions? 060-904-1056.
Teaching you something new every day. Radio Al Ansar.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
حديث أدي قال رسول الله صلى الله عليه وسلم الحياء شعبة من الإيمان. Modesty is part of Iman. A person who has true Iman will always be decent and not rude. Modesty and shame should be shown in everything. A person's speech, dressing and manners should always be respectful. Dressing correctly plays an important role in modesty. We should always dress modestly and protect our shame.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
Are you looking for a meaningful way to fulfill your zakat obligation? Look no further than Ashraful Aid. With our trusted track record, your zakat reaches those who need it the most in the most honorable and dignified manner. Visit our website at www.ashrafulaid.org.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a day. It is the sunnah of the Prophet sallallahu alaihi wasallam to wear shoes and cover the head before entering the bathroom.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
Radio Al Ansar, 24/7, 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
أحب الوفي الأمين الأغر فأهل الوفاء كلون السحاب وحسن الربيع وماء المطر أحب الوفاء بشكل.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion, health during menopause. Our specialist guest, Dr. NASEERA Mohammed, a specialist obstetrician and gynecologist practicing at the Westfield Hospital. And our WhatsApp number for any question that you may have for Dr. Mohammed, 060-904-1056. A few questions come through, Dr. Mohammed. The first question is there a female version of Viagra?
That can only be a manna.
Of course.
So, in the past, we used to use testosterone implants. We had a little device and we'd load these implants. And the woman loved it because, the ovary has testosterone, estrogen, and progesterone. And besides libido, testosterone is also responsible for energy and verve. So the woman loved the testosterone implants. Unfortunately, that went off the market. And more recently, we've looked at compounded testosterone. And so now there are testosterone patches that have become available. And that would probably help women in terms of libido. But I think also important is men being supportive. And we always say the woman's G-spot is in her brain. So if she has a partner who's supportive and loving outside the bedroom, it helps women like that. Men are very different to women in the design in terms of their libido.
Salams, doctor. When I was 46 years old, my uterus was removed. Now I'm 69 years old. Must I still go for a pap smear?
So you would still have what looks like a pap smear, but it's called a Wald smear. So the pap smear is taking the cells from the cervix, but when you have a hysterectomy, that cervix is removed. But those abnormal cells can also be at the vaginal vault, which is the part we stitch together after the hysterectomy. So it is still important for women to do a vaginal vault smear. And then more importantly, if her ovaries were left behind, she needs to have a transvaginal assessment of the ovaries to make sure they are not increasing in size or developing cysts, which can still happen.
What she says is, I also have a prolapse of my vagina.
Okay, so prolapse depends totally on her symptoms. If it's bothering her, if she's having difficulty voiding or emptying her bladder or emptying her rectum completely, then obviously she needs to have that fixed, and that can be surgically fixed. In mild cases, even vaginal estrogen helps for that. It's normally women who have not had vaginal estrogen who later in life develop prolapse because of atrophy, or if they're chronically constipated of lifting heavy things. So it depends on her degree of prolapse. If she's got a mild prolapse that's completely asymptomatic, she's voiding nice, it's not bothering her in any way, she can leave it alone. But if it's making her uncomfortable, making voiding difficulty, or it's difficult to empty her rectum completely, then there's surgery to fix that.
Salams, is there a specific multivitamin that one can take daily during menopause? Can taking contraceptive pill not assist during menopause?
So, actually taking the contraceptive pill can assist with menopausal symptoms. And many women who've been ligated between 40 and 50, we would put them back onto the pill because they because of the hormone imbalance, the period becomes unmanageable, it becomes more painful, it becomes irregular and heavy. And we use the pill to mask the symptoms of menopause. The general recommendation is at 50, then we should think of coming off the contraceptive and switch over then to hormone replacement therapy to manage the symptoms.
And insofar as any specific multivitamins are concerned, is there a specific multivitamin that one can take daily during menopause?
So I think the important vitamin would actually be your calcium and your magnesium and vitamin D. Those are important. And general health issues like the omegas and that. So it's nice to eat your vitamins. So a diet is extremely important. So I think that's important. Because lots of people take so many vitamins and they just end up with expensive urine because not all of it is absorbed well. So I think it's important to do a good diet, drink lots of water. Exercise is more important than vitamins, in my opinion. But calcium and magnesium is important also.
Assalamu alaikum wa rahmatullahi wa barakatuh. Wa alaikum salam. What can one do for anxiety and depression during menopause?
So for me, I would think the first line therapy would be hormone replacement therapy, because then you are then addressing the cause of the anxiety and depression during menopause. But if a woman is having suicidal thoughts or severe depression where she's not out of bed, unable to function, then that particular person needs to have a good assessment, some supportive psychotherapy, and may actually need a psychiatrist. Then she would need an antidepressant or an anxiolytic depending on the assessment.
Assalamu alaikum. Please speak more of how perimenopause and menopause cause a woman's libido to practically disappear. Man needs to know how to deal with this phase in a woman's life and not immediately assume she's seeing another man. I know of so many women that have walked out of marriages or have been given talaq because of the lack of understanding of men in this phase of a woman's life. I think it's a very important question.
I think that's very, very true.
Yeah.
And we see that all the time. I think what's important is that, if we look at it, women have a libido to reproduce. So what, just from a physical point of view, the libido is to reproduce. So once you reach menopause, when you no longer can have babies, there's physically no need for a libido because you're not going to have babies. But men can reproduce well into the 60s and 70s. So therefore, their libido does not go to propagate the species. But having said that, it's important for a marriage that the sexual relationship is still ongoing. Unfortunately, women are going to have to put a lot of effort into that because even though men may be understanding, and I always say to patients, if your husband's too understanding, you should get slightly worried because, some women have become quite blasé about it and they just would say, well, no, my husband's very understanding, and then they avoid it completely. But I think men still then become vulnerable to temptation if it's just because the way we are built differently as in terms of gender. But I really feel if there's an issue, women should address it with their partner. And it's very true. Some men get quite offended and think that they're not interested in them. But the important thing is not to neglect that aspect, not to become apathetic and say, we don't feel like doing it, so we're not going to do it. Because the less often you have intercourse, then it's less likely for you to continue, especially as you're developing vaginal atrophy. If it's not regular dilatation, then you lose volume of your vagina, and then physically it becomes painful for another reason.
And can that condition be addressed or reversed?
With vaginal estrogen.
Okay. Another question that comes is, does fibanserin work for the woman's libido? Fibansarin.
I'm not familiar with that. Okay. Yeah.
Another question, can the Mirena, M-I-R-E-N-A, help with menopause symptoms?
So the Mirena will help very well with the abnormal bleeding of the menopause, but it does nothing for the menopausal symptoms in terms of hot flushes, sleep disturbance, hair fall, bone density, and none of those things, joint pain.
Salams, doc, off the topic, but please let me know. For osteoporosis tablets, are they safe or drip once a year tablet? 4 servants once a week. Jazakallah.
All right. So obviously, osteoporosis is not where we want to end up because it's has quite a severe impact on the general health of women. And hopefully, if we start the hormone replacement in time, we never get to osteoporosis. But osteoporosis is a silent disease. She's lucky to have detected it because if you treat it, you can then prevent fracture and prevent height loss and prevent curvature of the spine. So first line, we would try Fosavance. And, if women are tolerating it well with no gastric symptoms, so there's a very particular way in which you take the Fosavance, then that's fine. And she's tolerating it and she's compliant. Then what would guide you to change the therapy is if after a year you repeat the bone density and there hasn't been a significant improvement, then we'd say maybe we would try an intravenous infusion once a year. Also to remember, osteoporosis, if we do a bone density and after a year you haven't had a massive improvement, that's still better because the natural history is that it would reduce in a year. Okay. So if your bone density is about the same, it means you're doing well.
Excellent. I think we've dealt with this question without, I'll just call it again. It comes from a different listener. Is it safe to take HRT for as long as they live? Besides hot flushes, what else does it help the body with?
So the hot flushes are really one of the minor benefits. I think the major benefits of HRT is in terms of bone health and cardiovascular health.
Mm-hmm.
It's also been shown to help with cognitive decline. So as women get older, the memory goes, the increased risk in dementia. So there's been lots of evidence now to say that there's cognitive improvement in terms of brain function in women who are on hormone replacement therapy. Then also benefits for the skin, for the joints, hair loss, those kind of things.
Okay, it's just coincidental. Another question just came through while she was speaking. Also has something to do with bone density. Salams, is there a need for bone density if your blood tests are done?
So the bone density is a scan to look at the bones and does a measure to say what's the density of your bone or how strong your bones are. And the age to start screening is about 65.
Mm-hmm.
But if you've got a strong family history of osteoporosis, then you can do your bone density early. It's also a good idea if a woman's sitting at 50 and she can't decide should she go on hormone replacement or not, then she can do a bone density. If she's got osteopenia, which is pre-osteoporosis, then that's the kind of patient you would say to her that if she commences estrogen therapy in the perimenopause, she probably wouldn't develop osteoporosis if she has a healthy lifestyle as well.
Thank you, Dr. Mohammed. We're going to visit the marketplace once more. We'll continue after this, inshallah, to stay with us.
Everyday Radio Al Ansar.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
It's official. Checkers Foods Kawi Park is our first food store with a halal butchery, bakery and deli certified by NIHT, the National Independent Halal Trust. This will ensure high standards and ethical practices across our butchery, bakery and deli from farm to table. So visit Checkers Foods Kawi Park for an exceptional shopping experience that keeps getting better and better.
The chaos and destruction in the Gaza Strip is beyond comprehension. Virtually everyone is displaced, hungry, and in urgent need of life-saving humanitarian support. The Al-Imdad Foundation has been working tirelessly to address the health, nutrition, and water needs of the population. Our hospital, water deliveries, and hot meal programs are made possible with your support. Your donation, big or small, is a lifeline for those in dire need. Help Gaza survive. Donate online at alimdad.com or call 0861 786 243 for more information.
This Heritage Day, the stage is yours. Radio Al Ansar is calling on the bold voices, the visionaries, the change makers. If you've got an idea that can shape the future, if you've been waiting for your voice to be heard, now is the time. Join us at Monty's Convenience Store in Pietermaritzburg at 268 Ortman Road on the 20th of September at 2 p.m. Stand up, speak out, and be a part of the conversation that defines tomorrow.
Radio Al Ansar.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You listen to Medical Files brought to you by the Islamic Medical Association of South Africa. And our topic for discussion is health during menopause. And our guest this evening is Dr. NASEERA Mohammed, a specialist obstetrician and gynecologist practicing at the Westville Hospital. Dr. Mohammed, another question has come through. Does HRT help prevent osteo?
Definitely. And that's like one of the major benefits there. There's lots of evidence to say that if we start hormone replacement therapy within the first 2 years of the menopause, in fact, within the first 5 years of menopause, you will make a big difference to your bone density ultimately. And it's very important to do that. Besides engaging in physical activity and weight bearing exercise. Because we do know now that, muscle strength is very important. So your muscle mass is the only immunity against aging. Osteoporosis, we must know 50% of people who have a fracture will actually end up wheelchair bound. So it has a huge impact on quality of life for women. And definitely hormone replacement therapy prevents osteoporosis categorically.
060-904-1056. Any questions for Dr. NASEERA Mohammed? You're welcome to send them to us via WhatsApp. We've got like 9 minutes left for this program. So if you have any questions, you can forward them to us. Now, Dr. Mohammed, we have discussed hormone replacement therapy quite a bit during the program. But let's discuss its role in the management of the menopause.
So hormone replacement therapy it's like the best example I can give you is women have underactive thyroid gland. So they got hypothyroidism and they go to the GP and the GP prescribes Altroxin or Euthyrox and they happily take that. Mm-hmm. So now when your ovaries are not making estrogen and you're going to spend another 30 years, if you live to about 85 or 80, you're going to spend at least 30 years in the menopause where your ovaries were making estrogen, they're not making estrogen anymore. And then it makes physical sense that because the ovaries have stopped making estrogen, we need to replace it. And hormone replacement therapy has a role because estrogen in a woman, there are estrogen receptors throughout your body. The brain, the hair, the skin, the nails, the heart, the bone, the vagina, so the bladder even. So we really, once you are on hormone replacement therapy, you then will prevent the decline that occurs once you reach menopause. So, but it's a very individual decision and people must feel that there is value for them in their lives. If they don't see value in it, then they don't need to take it. But nowadays I see there's a big move to people doing natural therapy and there may be a role for it. But if the women are not getting relief from it, then I think they should consider it if they're comfortable with taking therapy.
There's a few questions which are off topic, but I'm going to read them off anyway.
No, it's fine.
Assalamu alaikum. Please, can doctor advise what causes low HCG during early pregnancy and is it a cause of concern? The HCG count has been doubling over the last 3 tests that were done, but it's still on the lower end for the current week of pregnancy according to the lab report. And the second question is, how soon should you see a gynecologist once you find out that you are pregnant?
Okay. So the big problem that I have with the labs having their apps on the phone where the patients can get the results, it's created big panic in patients because the patients read the result and the lab will call it L, like low, and it means there's an issue. So if you have a normal intrauterine pregnancy, that means the pregnancy is sitting in the correct place, your beta HCG level should double in 48 hours. So if your beta HCG level doubles in 48 hours, that tells us it's a healthy pregnancy sitting in the normal place, and a patient should then have an ultrasound between 6 to 8 weeks. The problem is I always say to patients, don't do a pregnancy test too early. Firstly, if it's negative, then you feel disappointed because you raised your hopes up. But if it's positive and you still very early, you rush off to the doctor and they do a scan, oh, we see nothing in the uterus, then you feel disappointed. Then we've got to do the beta HCG. If it doubles nicely, then it tells you that it's a healthy pregnancy. If this patient's down, then the other test you can do is a progesterone. So in a healthy pregnancy, you will have a progesterone that's greater than 25. So that's the other test to do if she's in doubt. But if it's been doubling every 48 hours, then that's probably a healthy pregnancy. I think the patient must not look at the app with the blood results, because the machines are automated and they will call any result as a L if it's just even 0.01 lower than what the normal cutoff is. So I think it's important to discuss those results with your doctor. But we shouldn't do it repeatedly every 48 hours. You should just do it once. If it doubles, it's fine.
Doctor, is HRT covered by medical aid as a chronic condition?
So they used to do it for a long time as a chronic medication, but now more recently, some of the medical aids don't take it as chronic. But you can always tell your healthcare provider to track.
Motivate. When should women be concerned about bleeding after the menopause?
So prior to the menopause, there will be a period of about 5 years where the bleeding pattern starts to change and it's up and down and all over. And then we normally do an assessment. If the patient on an ultrasound scan, everything looks fine, then we can watch it and give her medical management of it. But if you've reached the menopause and you have not had a period for a year and then you bleed, that needs investigation. So that means if your period has stopped, we used to say a year, now we say even if it's 6 months that you haven't had a period after the menopause and then you bleed again, it's important to have it checked, because there could be polyps, there could be growths, and you need to diagnose that early.
What are the side effects of HRT?
So the side effects are generally, some patients initially when they start, you may feel a little bit of nausea because of the estrogen. Like some women get nauseous when they're pregnant and other people don't. So it just depends on their body reaction. Some patients may feel like they get some breast tenderness, which generally settles after 10 days. If you have a background history of clots, you should not take it. So if you've had a pulmonary embolus before, deep vein thrombosis before, then you should not take hormone replacement therapy.
I am 43 years old and already in menopause, according to blood tests by the gynecologist. I'm suffering from hot flushes a lot.
So at the age of 43, that patient, once she's had a good assessment by the doctor, would be the ideal candidate for hormone replacement therapy. Because at least until she's 50, which is the natural age of menopause. And if she's suffering with the hot flushes a lot, then it means she needs the therapy, but she must be comfortable with taking it. That's why I say everyone should read the blind spot if they're skeptical about hormone replacement, because it gives you very factual information. You can make your own informed decision.
I think we've got like a minute to answer the next question. What routine checkups are important for menopausal women?
So the important checkups are a mammogram. I feel every woman over the age of 40 should have a mammogram. And we pick up so many cases of breast cancer on a routine screening, even though you examine the patient and you feel no lumps, but the mammogram can detect it early. So you don't need to lose a breast. You can just have the lump removed. The other important test, and we generally say at 50, every woman should have a colonoscopy. Well, every woman and man should have a colonoscopy and repeat it every 10 years. The other important test is cholesterol screening. You should also do a blood sugar, a thyroid, and we say bone density. Bone density, medical aids pay when you're 65 or above. If you are having a debate about whether should I or shouldn't I, then those patients should do a bone density because it will guide their decision scientifically. If you've got osteopenia, then you're definitely going to benefit from hormone replacement therapy. If you start HRT once you've had osteoporosis, you've almost missed the window. It will still benefit, but it would be far preferable to start it before you get to osteoporosis.
Dr. Naseera Mohammed, thank you very much for joining me in the program this evening. I know
my
time really
pleasure.
flew. Questions have been pouring in. I thank all the listeners. I want to thank all the various technicians in the various radio stations for the sterling piece of work done this evening. And yes, I want to thank you, the listener, for having joined us. Dr. Naseera Mohammed, you don't get away. Do you have a message for our listeners?
Oh, well, definitely. I think that every woman should live each day to the fullest. And when you reach menopause, I think you start to live your best life because you know yourself better. You value relationships and time more. So I think really you should use it to celebrate your life, exercise, and be the best version of yourself. I think we give our youth to our family, to our children. And when you reach menopause, that's the time for yourself. Although we still give in to our children and family, it never ends.
Absolutely. Thank you so much for joining me. Allah SWT will reward you for your sacrifices, for having assisted us, with your knowledge, etc. And all the best to you. Time. Okay, I see another question comes. Can we have another session, please? Part 2. Inshallah, I'm sure in due course we will. Thank you so much. And for myself, Faizal MJ Suleman, it's Assalamu alaikum wa rahmatullahi wa barakatuh.
فأهل الوفاء كلون السحاب وحسن الربيع وماء المطر. أحب الوفاء بشديد الصور أحب الوفي الأمين